All right, let's get started. Hello, everyone, and welcome to the EmpowerDent webinar. My name is Dr. Nicholas Mercer, and we'll learn a little bit more about me in a couple slides. But I wanted to thank you all for really taking the time out of your day to do something that is going to invest not only in your health, but the health of your clinic and the health of your entire dental team. So going to have a lot of good information in this webinar on preventing and managing musculoskeletal pain. So let's just get right into it. So first of all, let's go over the objectives. So what you should take away from this. First, we're going to understand the epidemic of musculoskeletal pain disorders that are plaguing the dental profession. We'll learn the 6 faulty postures that are the ultimate cause of the back, neck, shoulder, and hand and wrist pain that dental professionals seem to experience pretty often. We're going to realize the consequences of absenteeism, presenteeism, and early retirement on a dental clinic's ultimate success. We'll identify the limitations of traditional ergonomic education and outline the 3-step approach that the EmpowerDent program takes to improve the wellness, culture, and financial success of dental clinics everywhere. But first, who's this guy and what do all those letters mean? My name is Dr. Nicholas Mercer. I am a physical therapist with my doctorate in physical therapy. I'm also a certified strength and conditioning specialist. But more importantly, I've also been a victim of musculoskeletal pain that was related to my lifestyle and my working habits. I have a lot of experience treating dentists, hygienists, and dental assistants in my office in Oviedo, and that has given me an appreciation for the work that these professionals do, but also the issues that they're starting to have and that are becoming more prevalent. So what is the problem? The prevalence of general musculoskeletal pain in dental professionals has been shown to range between 64 and 93%. Well over half, almost all dental professionals experience some sort of musculoskeletal pain in their career. And this often results in reduced productivity, both in terms of missing hours of work, but also reducing overall workload. In fact, pain in these professionals results in inefficient movements when working, and that causes each procedure on a patient to take up more time, which means fewer patients are seen. And musculoskeletal pain eventually causes an inability to work and early retirement from the dental profession. So after the patients that I've seen and reading the research on musculoskeletal pain in dentistry, I kind of came to the same conclusion that these studies did. These patients had pain because of their work. The risk factors were shown to include static and awkward postures, which you, as a dental professional, know very well you have to get into in order to do your work. So what did I do? I shadowed dentists, hygienists, and assistants, and in that picture you'll see Doctors Austin and Denise Hohen. They invited me to shadow their staff at LFA Dental Care and helped me identify these 6 common postural problems and start to put together a system that helps prevent and manage the pain that is a result of these postural issues. So huge thanks to them. So what are those 6 postural issues, those 6 faulty postures? Well, the first one is going to be lower crossed syndrome. And so we're going to get a little anatomical here, which you all should be a little more comfortable with than people I usually talk to. So it's a common result of prolonged seated posture. So it's not necessarily unique to the dental profession. It's relevant to any profession where you sit for prolonged periods of time, which is essentially most professions right now in today's society. But nonetheless, it is incredibly prevalent, and it has been shown to lead to things like lower back pain and sciatic nerve pain, or sciatica. And it's a consequence of that prolonged sitting. So when you sit, your gluteal muscles turn off and your abdominals turn off. So something has to stabilize your spine. And what takes over for that are the hip flexors, the iliopsoas, and the erector spinae, which are basically trying to hold your spine in a posture. But that also throws off how the lower back works, resulting in this lower cross syndrome. It's called lower cross because you have that one angle that's weak and that one angle that's quote unquote tight. I like to say overactive. So similarly, we have upper cross syndrome. It's similar to lower cross syndrome, but it's in the cervical and thoracic regions. And so what we get is these weak or inhibited deep neck flexors in the front of the neck, and rhomboids lower trapezius and serratus anterior kind of in the middle thoracic spine that are controlling. They connect up into the thoracic spine and the rib cage and the scapula. And what that causes is tight or facilitated overactive pecs and sternocleidomastoid in the front, and then tight upper trapezius and levator scapula. So it's making your head go this forward head position. And again, not unique to the dental profession, but in my professional opinion, I think it's more severe, because when you're sitting at a computer, you can kind of control where your head is. You can control the distance between your screen. You can control the comfort a little better. When you're trying to access the oral cavity, you may have to lean forward a little bit more to really see inside there, especially if you're not using loops. And this has been shown to result in shoulder, neck, and upper back pain, but also chronic cervicogenic headaches and neurological symptoms from the neck all the way down, even into the fingertips, down the upper extremity. The next one is functional cervical scoliosis. Now, I say functional because we have to distinguish functional and anatomical. Anatomical would be you were born with this. This is how your body was made. But what we see more in dental professionals is a functional cervical scoliosis due basically to muscle imbalances. So the good news is that that can be more or less reversed because it's not anatomical, it's more functional. But this one is pretty unique to the dental profession because a lot of times we're sitting on one side of the patient, and so we have to turn our bodies and then let our head turn in reaction to that. And you'll see the picture of me here. I'm taking a posture that I saw a lot of dental professionals use. And basically, the head looks vertical, but since the body is at an angle, we're actually getting that angle in the neck. And you can see on the right side of my neck there, you can see the wrinkles in my skin from turning my head this way in order to view the oral cavity and get over the patient. And a lot of this is due to, from what I've been hearing from my patients, is widening patient chairs in the dental clinics, especially in America. So that means we have to lean over more to access the oral cavity, and it just amplifies the effects of this functional cervical scoliosis. And this often results in neck and shoulder pain, as well as headaches, and again, those neurological symptoms that can go all the way down your arm into your fingers, that numbness and tingling that you may get. And then we have functional lumbar scoliosis, similar to the cervical, except it's the lumbar spine. And you can see here how the lower back has to turn and side bend in order to reach the patient's oral cavity because of those widening chairs. And then the head cocks the other direction to compensate. So again, we have to lean over patients, turning to reach tools or access parts of the oral cavity, and this will often result in lower back pain, even hip pain, and that's those sciatic symptoms all the way down, sometimes into your foot, the numbness and tingling in your foot, but a lot of times pain down the back of your hip and the back of your leg, and a sciatic nerve distribution. The next one I saw, I observed, was internally rotated shoulders. And the easy way to spot this is don't look at the shoulders, look at the elbows. The elbows are kind of up and flared like that. It's internal rotation at the shoulders, which it's difficult as a dental professional. And the reason I say that is you were taught, okay, I have to keep my wrists neutral. We'll get to that. But if my wrists stay neutral, but I have to achieve a certain angle in the oral cavity, I have to move something else to get there. And a lot of times that's turning the shoulder in to access the oral cavity. Like a lot of times it's in the back, and in the back of the oral cavity and at a certain angle that you need to accomplish. And so this will often result in shoulder pain, and it's a common cause of adhesive capsulitis, also known as frozen shoulder, and anterior shoulder pain or shoulder impingement. I put impingement in quotations because there's some research to suggest that it's not a true impingement. In my the way I see it, it's kind of a functional impingement, but it's not really an anatomical impingement. But we're moving away from that term impingement to more like an anterior shoulder pain syndrome. Regardless, you don't need to know that. That's just some information that I wanted to put out there, not that you care. But yeah, this can often result in some pretty intense shoulder pain because the shoulders are turned inward. And just to be clear, it's the shoulders that turn inward, but you'll see the elbows go out as the shoulders turn in. So just to any confusion that may result from that. And then finally, we have wrist hyperextension and flexion. So again, we want to keep the wrists neutral, ideally, but this is going to happen. You have to get different angles. You have to reach difficult parts of the oral cavity. Your wrists are going to do this. They're going to be in flexion or extension when you're working, just to do the work that you do. So using those tools in a small oral cavity definitely contributes to this weird these weird wrist positions. This one's a little more unique to dental professionals. It's not like you're using a keyboard and mouse where you can keep those wrists neutral and kind of in one position. You have to be moving and getting different angles, and that oral cavity is so small for hands to be working in. And this often results in wrist and hand pain, a lot of times carpal tunnel syndrome. And that's kind of pain with the median nerve as it goes through the carpal tunnel in your wrist, and it can result in a lot of pain in the hand and the wrist, and even some numbness and tingling. So I want to talk about the consequences of these postures and the resulting musculoskeletal pain. So number one, musculoskeletal pain will keep a lot of people from exercising, staying healthy, staying active. And a lot of times, so mental health disorders and musculoskeletal pain are interrelated. And by that, I mean, one contributes to the other and vice versa. So there's research to support that mental health disorders can be increased as a result of musculoskeletal pain, and mental health disorders will, let me go back. So there's research to support that when you have musculoskeletal pain and you're not able to do the things that you typically do when you don't have pain, it can cause depression, anxiety, some different mental health disorders. However, it works the other way too. So mental health disorders have been linked to something called hyperalgesia, which is basically an increased sensation of pain more than necessary. So you probably have the pain, but since you also have depression or anxiety, that pain signal is essentially being amplified by your brain. And so it becomes a vicious cycle of depression and anxiety, making the pain worse, which makes your depression and anxiety worse, back and forth, just like that. Ultimately, it results in decreased function both at work and at home, again, contributing to those mental health disorders, a shorter career in the dental field, and ultimately an unfulfilling career and a sedentary lifestyle. But for the clinic, we also have some consequences. And those basically are employees work fewer hours because they're in pain and they don't want to be in pain. And doing the dental work makes them have more pain. So they work fewer hours. When they are working, they're less productive because of the pain. It makes them work slower. It makes them work less efficiently. The movements they have to accomplish become less efficient. And then employees leave the profession, and the clinic needs to hire another employee, which typically costs 1.5 times the employee's salary. So it's very expensive to find another employee. It also negatively affects the culture and camaraderie of the whole team. People are in pain, they get grumpy, angry, frustrated, and it doesn't contribute to a healthy work environment. Ultimately, the clinic loses a lot of money, but it also loses the reputation with patients. Patients, especially for dentistry, do not like rescheduling. And so if an employee has to miss work because of pain, if they're less efficient, or they don't provide as high quality of a patient experience, that's going to reflect in things like Google reviews, returning patients, and just overall how these patients see your clinic. Is this a healthy, thriving, happy to be here clinic, or is this a clinic that I dread going to every day, or every day that I have an appointment? Do I not look forward to my visits? And that reflects on the clinic in a couple ways, but ultimately it will lead to a loss of revenue. So let's talk about why these popular ergonomic seminars don't really work. So ergonomics are very important, incredibly important. Proper ergonomics are an essential part of the prevention and management of musculoskeletal pain in the dental profession. However, it's not a complete solution. A lot, if not all, of the ergonomic programs and seminars that I've seen basically say, here's how you should be working. Here are the proper positions. Here are some tools you can use. Okay, here's the information. Have fun. Good luck. And I don't think people realize how impossible it is to maintain perfect ergonomics all the time in the clinic, because your work would suffer. You would be thinking about ergonomics and not about the patient in front of you. You should not have to worry so much about proper ergonomics. We want to make sure that everything is set up so that you can optimize proper ergonomics, but we have to realize that it's not perfect. It's not going to be perfect, because if your ergonomics were perfect, your treatment wouldn't be. So another component is these ergonomic seminars and programs, they don't have ongoing support. They don't follow you through, a time span to make sure that these changes are being implemented. Again, there's no implementation system, and it's missing some pretty key components necessary to achieve a healthy and thriving dental seaming clinic. And in addition, I have never seen an ergonomic program or seminar for dental professionals that is run by a doctor of physical therapy. They're usually other hygienists, and they do great work. They're very knowledgeable. I don't want to diminish those skills at all, but they're definitely doing good work. They're contributing to the profession and to the prevention of musculoskeletal pain. It's just not a complete solution. And so what I did was I took these 6 postures, I took the ergonomic information, and I took the typical, most common pains that I've seen in these professionals, and used my knowledge as a doctor of physical therapy and as a person who's had musculoskeletal pain that affects their work before. And I systemized it into the only system designed to combat the epidemic of musculoskeletal pain in the dental profession. Call it the EmpowerDent Program. I know it's kind of a cheesy name, but bear with me. It's a 3-pronged approach. So we do have basic ergonomic setup and education, stuff you've probably seen before, but a little more systemized, a little more lenient, not needing you to be perfect, but trying to optimize everything. But that's a good introduction to this program. But where the meat and potatoes is, the really important stuff, is in the systemized 8-week corrective exercise progression. So this is a specific exercise progression that is specifically designed to help offset and reverse some of these postures that we have to get into during our work. And it's very easy to follow. I put it in a very specific order, specifically for dental professionals to combat the unique movement patterns and positions that they have to get into. So we can start preventing musculoskeletal pain from coming. But pain happens. Even if you are working really, really hard to maintain your healthy movement and proper ergonomics, pain is going to happen. And so the third part of this program is pain management techniques. These are self-manual techniques that you can do on your own, on yourself, to help manage pain when you do have it. So if you wake up and your back hurts, you don't have to call out of work. You don't have to be miserable all day. You can manage that pain without pills, without shots, without surgeries, just with some manual therapy techniques that you do on your own until you can get the proper treatment. So you can make it through your day comfortably until you can go see your physician or go see a physical therapist in person. A lot of times these pain management techniques, they resolve the pain too. But I would never promise that. Always, if you're in pain, you need to see a professional. But really the goal of this program is for the individual and the clinic, right? The goal is to make dental professionals happier, healthier, and free from pain, and to prevent pain that will keep them from continuing the valuable work that they do, but also for the clinic to prevent loss of money, to make more money, improve their patient experience, but also improve the culture and the team and make the clinic a more enjoyable place to be for everyone. Unfortunately, so I've implemented this with a few clinics and it's been going incredibly well. We've been seeing really good results from a physical, subjective, how do the employees feel, how do the team members feel, but also from just an efficiency standpoint. However, I can only work with a few clinics at a time, a limited number of clinics at a time, and that's because in order to implement this system properly, it requires guidance from a physical therapist, right? And by working only with a few teams with a limited number of clinics, it ensures that I can help implement the system effectively for each clinic. I treat dental clinics like I treat my own patients, and that is they get my cell phone number. They can contact me and reach out with any questions or concerns. They basically have access to me for anything that is relevant to the program and relevant to preventing the musculoskeletal pain and making the clinic thrive, making the clinic continuously improve their performance. But I value my work very strongly. I would rather my work be incredible and really, really effective than get paid for doing nothing. That's not what I want. I want to see a transformation in the dental community towards basically what is here is transforming the dental community into efficient, highly productive, and thriving teams, right? So if you're interested in transforming your team, your staff into an efficient, highly productive, and thriving dental team, let's set up a demo of the program. No obligations. Text or call me or email me, and you should be able to see all that information on the screen. But also, if you got an email linking to this webinar, you should be able to just reply to that email and that'll go straight to me. But let's set up a demo. Let's walk you through this program and make sure it's right for your team. This demo will include a walkthrough of the program. So you'll see the whole program. You'll get an idea of how it's structured and why it's so effective. A list of everything that's included outside of this online program that is guided by a physical therapist, and answers to any and all questions or concerns that you may have about the program or implementing the program in your clinic with your team. And again, there's no obligations to move forward with the program if you feel it's not right for you and your team. You know your team better than anyone. So if you say, you know what, this isn't right for my team, I will say, yeah, you're probably right. You know them better than I do. If you need anything, let me know, but it doesn't sound like this program is right for you. So thank you for your time, and I hope you gained a lot, but you know, it's not right for everyone. But I think this is, and I truly believe, and it's been shown in the clinics that have implemented it already, that there's a huge value with this program, especially with the physical therapist guidance. And I want as many clinics to benefit from this information as possible. So please just keep an open mind and let's set up a demo. I'll show you everything. I'll walk you through everything. I'll listen to your feedback. We'll get your questions and concerns addressed, and we'll figure out if this is going to make your clinic more successful and make your team happier, healthier, and more productive. And so here's some references that I used, and I just wanted to thank you all for coming to this webinar and using this information and really investing in not only your own health, but the health of your team and the health of your clinic. So if you have any questions at all, even if it's not about setting up a demo, if you just want to shoot me a question, call, email, text, I'd love to start a conversation with you and just figure out how I can help you. So thank you again. This was awesome. And I look forward to learning more about you and your team and your clinic and the problems that we can hopefully help you solve. Have a good one.